Hello and good afternoon to everyone. Welcome to Facebook Live with Gleneagles Global Hospitals. This afternoon we are coming to you from Gleneagles Global Hospitals, Richmond Road, Bengaluru. It is my pleasure to have with us Dr. M.C. Uthappa. Dr. Uthappa, thank you for joining us. Dr. Uthappa is the Director of Interventional Radiology and Interventional Oncology at Gleneagles Global Hospitals. He started his career from Government Medical College, Mysore. He spent a lot of years training and practicing in the UK. He is a fellow of the Royal College of Surgeons, Glasgow, fellow of the Royal College of Radiologists, London. He has more than 30 years experience in the medical field, most of it spent in radiology, interventional radiology, and diagnostics. He is a research bug. He's written publications and he's contributed to several leading journals. This afternoon, Dr. Uthappa is going to talk to us about interventional radiology in varicose veins, in fibroids, and in prostate cancer, or prostate specifically. Doctor, let's begin by asking you, what exactly is the space of interventional radiology?
Thank you, Venus, for the question. Interventional radiology is basically a new subspecialty of a radiology, wherein we are able to do pinhole surgery and treat various conditions in the human body.
Right.
Essentially, these are procedures which help the patient who cannot have a surgery or who do not want the surgery. Okay. And the biggest advantage is these patients will avoid any form of scar, no general anesthesia, and predominantly a procedure is well tolerated by the patient.
Okay.
And interventional radiology is so broad that pretty much in any part of the body, an interventional radiologist can go and help the patient.
Okay, sure. So you very interestingly use this term pinhole. So far I've come across keyhole surgeries, minimally invasive surgery.
Yeah.
So can you dwell a little bit on the pinhole aspect?
Yeah. I mean, just to take you back, what it was, open surgery was. One good example to quote would be removal of a gallbladder. When people have gallstones, people get a gallbladder removed. In the past, it could be done open operation. So, you can imagine the patient has general anesthesia, they have a big cut in the upper abdomen, and then the gallbladder is removed.
Right.
Over the years, then, people found newer ways to treat these conditions, and laparoscopic surgery came by, and that was commonly called as the keyhole surgery.
Right.
And moving forward from there is where interventional radiology comes in. So it's probably one of the fastest developing specialties, wherein the terminology like pinhole surgery is coined.
Right.
So what it means is that there's virtually no scar. There is no need of any suture or a stitch. It is, when I mean pinhole, actually the size of a pinhole. So it is a tiny nick in the skin that we can go.
Right.
And we can get into the patient's body either through the artery or through the vein or directly into the liver, kidney, lung, and treat various conditions of the human body.
Sure.
So clearly you can see that pinhole surgery is almost probably the ideal terminology where we say the least invasive, minimal invasive, and broadly we can also call it as something like image-guided therapy.
Okay.
So we use either an ultrasound or a CT or an MRI or X-rays to guide the interventional radiologist to reach to various parts of the human body and treat various conditions.
Right. That's fascinating, friends. As Dr. Uthappa has been explaining, this is the next level or the next generation of surgical procedures. In fact, prior to this conversation, he was talking to me, he was talking that they don't even refer to this as surgical procedures. They are just procedures. So if you have any questions on our subject matter this afternoon time, feel free to drop in your questions in the comment section. Dr. Uthappa would be more than happy to answer your queries. You can ask questions on interventional radiology, on the role of interventional radiology on varicose veins, uterine fibroids, and of course, in treatment of prostate problems. So, sir, like you were mentioning, is this now going to be the gold standard of treatment procedures for at least some of these conditions which were earlier treated surgically?
Yeah, I mean, the terminology of gold standard might be a
little
daunting for people who don't understand. I think what is important for everybody to understand would be that certainly any new treatment that's important that every interventional radiologist all over the world will follow that. And the same applies to coming off, just to shoot off an example, would be something like varicose veins.
Right.
So we know varicose veins is an extremely common problem. And in the past, even when I went to medical school, the only option, even when we were junior surgeons, we would just do surgery for these patients. Today, the requirement for surgery for varicose veins is probably close to nil.
Right.
So if somebody has varicose veins and they're troubled by them, which unfortunately is a very common problem,
Right.
one could broadly just say toss of a coin. 50% of an adult population would have varicose veins.
Right.
Slightly more common in women compared to men. And anybody with a predisposing factor of prolonged standing, an occupational risk attached to it,
Right.
they would have varicose veins.
Right.
And they can see an interventional radiologist and they can get these veins treated. And the treatment for varicose veins has evolved in the last decade or so predominantly.
Right.
And certainly in India, we have various options available now. Two things I would like to touch upon would be something like, if somebody has got small varicose veins, one can, without surgery, treat them with something called an injection therapy, also called foam therapy, which is a walk-in, walk-out procedure done under ultrasound guidance. And for the larger veins, whenever the patient is suitable, based on a Doppler scan, we would be able to offer them a laser ablation. Essentially, the veins are abnormal, they're not sending the blood back from the leg, so we could get into these veins with ultrasound guidance and then use laser to use high energy heat treatment, therefore obliterating these veins. And essentially, again, a daycare procedure without any scar, without any general anesthesia, they can get rid of the problems associated with varicose veins.
Sure.
So that's the big benefit.
Yeah. So you're talking about varicose veins, and some of our viewers are buzzing in with their questions, so let's get right to it.
Sure.
So I have with me Mr. Venkat Ramanan, who's asking, will varicose veins create any functional problem for them? So it's not specifically with the role of interventional radiology, but generally I think he would like to know if having varicose veins will have any functional problems.
Yeah, thanks for that query, and I think, it is a functional problem. So basically, one simple way to understand it is we have a heart that pumps the blood to different parts of the body.
Right.
And the blood taken to different parts of the body is through the arteries. And then we are designed with veins, and they go against gravity.
Right.
So if you imagine somebody is standing, and the blood has reached the lower part of the leg, it has to go back to the veins.
Right.
And there are valves in them. So imagine the blood has gone back, there's going to be a valve which is going to close. In people who have varicose veins, the valves don't function very well. So what happens, the blood vessel which is in the leg is going to keep increasing in size, and then the pressure goes up, and then the problem. So the functional problem would be that when a person with varicose vein wakes up in the morning, they're absolutely fine. By the time they've gone to the toilet and used just 5 minutes of brushing, and they will start getting pain in the legs. So then the problem is aches and pain comes, then they are not able to function better.
Right.
So the predominant problem will be heaviness of the legs by end of the day or even by late afternoon.
Right.
And then obviously the pain is going to be a problem.
Right.
So if I can extrapolate,
Further.
function of the leg is obviously going to be affected.
Right.
So there are a lot of, we take a lot of pride in counseling all our patients and telling them how to look after the legs. And that's the message I'd like everybody to have, is that you should learn how to look after your legs, particularly if you have varicose veins.
Right.
Because if you are able to do regular walking, wear a correct pair of stockings, see an interventional radiologist, see if these veins need treatment, then clearly there will be a huge shift, almost that once the varicose veins are treated, that you almost will forget you ever had a problem with varicose veins.
Right.
So the earlier one is able to detect the problem, the earlier they're able to reach out to a specialist would be the better. So I hope I've answered the functional aspect.
Right. So Venkat, I trust, like Dr. Uthappa said, your query has been satisfactorily answered. So moving on, we are specifically talking about the interventional radiology aspect in varicose veins. So if you can draw us a contrast as to what was the traditional methodology of treatment and how does that compare to using interventional radiology?
Yeah. So in the past, if somebody had varicose veins, even to the extent that when I went to medical school and even when I was a junior surgeon, one of the common operations we would do something called ligation and stripping. What essentially means is the full length of the vein, of the leg, there is a long vein, and that's the one which is the culprit vein. So we would put in a device into the vein and literally strip it. So what means we just pull it out of the leg. And that caused a lot of bruising and a lot of
Is it as bad as it sounds?
When I look at it today from a very finessed and a very specialized technique that we do, yes, it does sound a bit gruesome. But having said that was the gold standard then.
Right.
But today we don't need to do that. Okay. Today it's a question of using an ultrasound machine, which most people would have had for detection of veins. Then it's putting a very fine needle into the vein, and then putting a laser fiber, and then just burning the vein. So it's almost a cakewalk from the point of the patient's recovery.
Right.
But obviously there's a learning skill, and we have to evolve in improving our technique. But hand on heart, I would say that surgery for varicose veins is almost a dead specialty. What we can't today, you would want to be offering minimal invasive therapy.
So friends, as Dr. Uthappa has been talking about interventional radiology and the role of interventional radiology, firstly, in treatment of varicose veins, if you have any questions for Dr. Uthappa, either on this particular aspect or on uterine fibroids or prostrate, feel free to drop in a comment. He'd be more than happy to answer your queries. Sir, now coming back to varicose veins, a lot of people don't actually go for the treatment option. One, it could be because there is a phobia for surgery or the procedure itself, or they just take it like it's not so much of a big deal. But now it looks like with interventional radiology, it's very easy to treat it, and then whatever small problem they may have, it can go away. So what do we tell people who don't want any kind of treatment for varicose veins?
Certainly that's an option. So I think the first thing is, if you are troubled by, for example, having some ache or some swelling in your calf or your ankle joint, you feel your legs are tired, then you should start thinking, maybe I have some problem with my leg pain. So the first thing would be to get to your doctor, get it examined, and then probably the first thing we would do is an ultrasound scan of the leg. So I think that's the minimum one would do. Now, once the scan has been done, if we do find that there are significant varicose veins, then obviously we will think of treatment options. So one should take stock of the situation, understand what the problem is, and then look at lifestyle issues. So for example, I was touched upon that if you are able to do regular walking, if you're overweight, you reduce your weight. If you have got an occupation which involves prolonged standing in a time, for example, a policeman or a woman or a teacher, they should learn how to keep walking with this, wearing this stocking. Then clearly by doing that much alone, they're able to, first of all, prevent the varicose vein getting worse. The second thing is the aches and pains they're getting, that also probably will go away. So it's not that if you have varicose veins, you have to have a laser treatment. Definitely not. I think if you learn to look after your legs, you would solve a lot of the problems. But before detecting, you must have some sort of suspicion that I should need to go see my doctor and get it checked. Because the problem is so common, I think it's really duty of that person to try and reach out to a doctor, a local physician, and at least get a scan done of the legs and see if there is something to be done. And the reassurance is that the procedure is not daunting at all compared to the old-fashioned surgery. You're able to get it fixed as a daycare procedure. Like I said, you walk in and walk out for predominantly, or it's a daycare procedure, and it's all done under local anesthesia. So it should be very, very patient-friendly, almost making it reachable to more people who had, if at all they had a phobia of surgery, it addresses that issue as well.
And cosmetically also, one, you are getting rid of those scars and
I mean, you touched upon cosmetic, and a lot of predominantly, the women will sometimes want to get a cosmetically benefit from that. So these varicose veins, they look ugly in the legs, and
darkening of the skin.
The pigmentation of the skin. They will sometimes have bluish, big veins in the legs. It doesn't look nice. So then clearly, even for cosmetic reasons, they could easily get it fixed here.
So some very encouraging thoughts there, friends, on the role of interventional radiology in treatment of varicose veins. Dr. Uthappa highlighted the fact that it is no longer required that you go undergo a very major procedure that cuts open the vein and brings it out and all of that. Very easy to treat varicose veins today with the help of interventional radiology. So if you have a problem with varicose veins and you've delayed treatment or have not gone for treatment for a variety of factors, I think now would be a good time to explore the option of interventional radiology. Dr. Uthappa is available here at Richmond Road, Gleneagles Global Hospitals. If you would like to see him, talk to him, he's definitely here to help you and help you overcome varicose veins. So we'll have to quickly switch over tracks for the paucity of time.
Sure.
So let's move on to uterine fibroids. So let's first very briefly understand what are uterine fibroids and then how interventional radiology is helping women with uterine fibroids.
Sure. Yeah, so a uterine fibroid is obviously a problem for the reproductive group of women. So somebody, say, 25 to 55 age group women. And they're actually small, predominantly small, or if not detected, obviously they can be large as well. They are actually smooth muscle tumors. So they're actually benign tumors. And I think that is a reassurance every lady should have, that they are not cancerous. The fibroid is a benign growth within the uterus. And it seems to cause a problem only during their age group. So if a lady has fibroid, but doesn't have any symptoms from it, let's say they're not bothered with heavy bleeding or severe pain or fertility issues during the younger age group, then if menopause comes in, the fibroid will naturally shrink.
Right.
However, if the fibroids are causing any of these problems, like I said, either excessive bleeding during the period or severe pain or getting large enough causing pressure symptoms. So, for example, the fibroid grows to a size that it starts to press on the urinary bladder or in the rectum. They seem to have constipation, backache, and generally during the time of the period, they become very socially withdrawn. And I think it's important to understand that today, again coming to the point that fibroids can be treated without surgery. And I think that is an important thing to understand. So women do not need to suffer month after month with all these period-related problems. They can easily consult an interventional radiologist and get the fibroid fixed. When I say fibroid fixed, we also know the fibroids have a lot of blood supply to them. So that's why they keep growing till the woman gets to menopause. So because there's a lot of blood supply, the first fibroid embolization was done in 1995. So it's 22 years of history we have of having produced consistently very good results. So I, in one of my articles, had written a rule of 90. What that really means is 90% of the women are suitable for fibroid embolization. 90% of the time they'll have a clinical success. That means if they have a problem related to the fibroid, they're going to get benefited. And 90% of the women will not need any form of surgery. And that is important. One of the points is sometimes a woman has an ultrasound scan because of a period problem. They go and get a scan which shows there are multiple fibroids. And often they are told that they will need surgery. And there's also a misconception that the fibroid will become cancerous. I want to make that statement very clear that fibroids are not cancerous. Therefore, if we can treat it without surgery, and fibroid embolization becomes a very good option, again, it is no scar, no general anesthesia, just 1 day of hospital stay. Again, thin hole, it's a tiny hole in the artery, one can go and cut the blood supply to the fibroid. So once the blood supply is cut off, the fibroid will shrink, and then the patient will get all the benefits which is intended for. So that the bleeding goes away, the pain goes away, the pressure symptoms goes away, and luckily for some women who cannot get pregnant because of multiple fibroids, they also have an equal chance when compared to surgery to become pregnant. So it's almost a win-win situation in all angles from what we know.
I think that is something very important for us to understand and underline that as Doctor mentioned, and as I would understand, I think if the surgical procedure is removing the fibroid as an interventional radiologist, you are actually hitting at the root of the problem, which is the blood supply, cutting that off, and then not worrying about what happens post that. And so a lot of women should be encouraged by this to seek treatment for fibroids. If you had any of the symptoms like the doctor was mentioning, menstrual problems, excessive bleeding, and social withdrawal problems due to pain and other things, it is something which you must consider. You must see a specialist. And there are pinhole surgery, not surgeries, procedures that are possible to take care of your worries. So, sir, now if we talk about cutting down the blood supply, as you were talking about, so what happens to the fibroid after that? Does it stay there? Does it come off, or what happens to it?
Yeah. I mean, it's a very common question when I consult and women ask this. So what happens? The fibroid has got a lot of blood supply, and therefore it continues to grow. So we first thing go and cut off the blood supply by using very small catheters.
Right.
So the first thing it happens is it doesn't grow anymore.
Okay.
Then because the blood supply is, the fibroid is deprived of the blood flow, it starts to shrink.
Okay.
So once the shrinkage happens, it becomes like a scar tissue that just stays there with you.
Okay.
So you don't actually need to cut the uterus and take it out.
Right.
You just have to shrink it,
Right.
and then you start to see the benefit literally a month after the procedure.
Right.
So because we know it's not cancerous, if we can solve the monthly problems of that particular lady,
Right.
we almost fix the problem
Right.
by just cutting the blood supply off.
Right.
So it's like trying to do a procedure which is tailor-made for the problem,
Right.
rather than go and take the uterus out
Right.
or take the fibroid out.
Right.
So, and that, because there is a good option like fibroid embolization,
Right.
people first should, consult interventional radiologist,
Right.
seek an opinion, and see if they're suitable. So we tend to do a scan before we see. So we do an MRI scan, see the establish the blood flow to the fibroid.
Right.
If there is blood flow, then we cut the blood supply off, and then obviously they're going to get affected.
Yeah, I'm just talking to you about this aspect. My mother used to often say, you don't take a board where a scissor is sufficient.
Okay.
So it's almost like that.
Very good analogy, yeah.
Yeah, so for all the women out there who are watching our broadcast this afternoon time, some very reassuring thoughts from Dr. Uthappa here. That if you've had fibroid problems and you're continuing to have them, and you delayed treatment due to phobia of surgery or the whole hassle of getting it done, I think with interventional radiology, you have a very safe, easy, hassle-free procedure available. So it is good for you to explore one. If it works out, nothing like it, you're back to being healthy, and your fibroid troubles are behind you. Sir, once again, we have to switch over tracks. Let's come back to the men. Let's talk about prostate. So how does interventional radiology now help people with prostate problems?
Yeah. So the specific area which I would like to touch upon would be the problem really of elderly men. So one thing is good that life expectancy is going up, men are living longer,
Right.
and the longer we live, and more, men have a prostate, which
Right.
obviously is an important reason we have it. And it's just that the location of the prostate is where our urethra, which is the urine pipe,
Right.
where the urine comes out, the prostate sits there. So whenever the prostate grows bigger, it tends to cause problems with our water work. So that's
Right.
the essentially problem. So as we grow older, to the extent that when you look at published theories, 80% of men above age of 80 will have a prostatic enlargement.
Right.
And most of them will have a problem with their water work. So as we get older, probably in an Indian setup, somebody above 60, 65 would start to experience prostatic problems.
Right.
And the problems would be a lot to do with the water work. So it would be like you're not able to hold on to the urine, you're rushing to the toilet, you go to any place, you want to find out where the toilets are,
Sure.
and sometimes you might even wet yourself because you've neglected it that far.
Right.
And then you can get infections from them.
Mhm.
And there is some disposition of infection coming onto the prostate, and that
Right.
can affect their sexual life also.
Okay.
So when these problems come, men are obviously seeking to go to see a urologist, and the scan detects the prostate has grown. So normally about 25 grams is the size of the prostate. So anything above 25, it starts to cause problems.
Right.
So the larger the prostate, the bigger the problem, and bigger the problem, the bigger the worry from any way of treating it.
Right.
So traditional surgery was the option. It's called TURP, which
Right.
is basically going into the urethra and then resecting the prostate, which is causing the block. So it's essentially, debulking the prostate. And that was a very accepted gold standard treatment even today.
Right.
But what has happened over time with new technologies emerging, prostate artery embolization. Like I talked about fibroid embolization,
Right.
for the men there is a parallel option of prostate artery. Again comes to the same point. Any growth in the body is only growing because there's increased blood supply to that area. So when a prostate grows bigger, there's a lot of blood flow to that. We detect where the blood we are able to, again, with the pinhole technology, we are able to get into these small branches which supply the prostate, and then we are able to shrink the prostate. Again, the procedure is no scar, no surgery, no bleeding, risk of infection is low. Again, just almost a daycare procedure.
Right.
They get the job done in terms of shrinking the prostate. And that's where interventional radiologists specialize in.
Right.
And what I see from the data which is emerging, there's a lot of research is going on,
Right.
is that, number one, if a person has had a surgery for prostate, let's say 2 years back, and if the prostate grows, again, surgery may be a problem. So clearly they become an option for them.
Right.
Prostate artery embolization for a big prostate. We don't treat anybody with a cancer. So obviously we do some tests, make sure there's no cancer in it.
Right.
But luckily that's rare. So if a person has had a very large prostate, a surgery may be very difficult to do with a lot of side effects.
Right.
Then again, prostate artery embolization becomes a very good option. And again, then the big question, if you have any fear of surgery, you don't want to undergo surgery, it's not the end of the road. You
Right.
still have an option. And I
Right.
think that is the one men who have prostatic problems can certainly explore today. Today the technology is advanced so much that we are able to fix the problem relatively easily compared to this. And there are a lot of benefits. There is out there a procedure like prostate artery embolization shown that it not only improves their water works in terms of getting rid of the problems they initially came with, they also have added benefits.
Right.
For example, in complications, even the smallest complication can be avoided when you don't need to do a surgery. So
Right.
then that is a big benefit which I think men will seek out.
Yeah. And I think given the location and all, I'm sure, especially in a conservative setup as ours, people are a little apprehensive to get operated of the prostate, and they want to delay it. So for all those people who had these mental blocks, certainly interventional radiology now has a solution for you. It gives you an option to look for a non-surgical way of treating your prostate problems and overcoming whatever current issues you are facing. It could be with urination and social issues and all of that. Whatever it is, like Dr. Uthappa has been talking to us this afternoon, with interventional radiology, all of it is very easily behind you. Sir, before we close, I'm actually out of my time, but just go beyond a little and talk about the practice of interventional radiology at Gleneagles Global Hospital for the benefit of all.
Sure. So basically, we have a team of interventional radiologists. We have a team of 6 interventional radiologists, and we cover hospitals in Bangalore, Hyderabad, and Chennai.
Okay.
And our new setup, as you already mentioned, the Gleneagles Global Hospital in Richmond Road, is fully equipped. So we've got state-of-the-art facility here, which has an ultrasound, CT, and a very high-end cath lab, which is the technology we use to do these interventional. And in addition, we are also able to offer a 24/7 cover. So all forms of emergencies also we do. So sometimes patient has a bleeding problem which can't be solved any other way apart from interventional radiology. We're able to offer that as well. So we have a very comprehensive team of interventional radiologists with also supporting teams. So we have interventional radiology fellows. We also have dedicated nurses, technicians supporting this, including support staff, for example, collecting data, publishing what we are achieving for our leading patients. So we have a fully comprehensive team in all our centers to be able to really offer these services to patients to really seek out for them.
Sure. And in addition to these 3 areas of varicose veins, prostate, and fibroids, are there others also wherein interventional radiology is making its progress?
I mean, like I said, at the time we only discussed 3 really issues, but almost I could say that any disease process in the human body can be addressed with radiology today.
Right.
And certainly we can offer the full range of services in our centers.
Right.
It can be any form of cancer in the body where surgery cannot be done, or somebody wants to avoid surgery, we can do that. Particularly in liver cancer, we have a huge experience and expertise in our team. Being part of the Gleneagles Global Group, we stand right up there in terms of reaching out to all complicated problems of liver disease. And similarly, other areas, including emergency treatment. So if somebody looked at the potpourri or a bucket of interventional radiology procedures,
Yeah.
we almost tick box everything.
Every box.
Yes.
Yeah. Well, friends, that was a fascinating discussion with Dr. Uthappa on interventional radiology and interventional procedures which can be done for varicose veins, uterine fibroids, and prostate problems. There is a whole lot more to discuss, and yet we are completely out of time on this broadcast. If you have any questions still, and you have not been able to get them in this broadcast, feel free to drop them in later on in our comment section, or drop us a mail. We'll try our best to get back to you. If you have any of these problems that we discussed, or would like to know more about your own problem and how interventional radiology can help, Dr. Uthappa is available here at Richmond Road, Gleneagles Global Hospitals. As he mentioned, there is also a team, so if you're not specifically from Bangalore and other places, there is a team which travels, stationed in different places, Hyderabad, Chennai, Mumbai, so they will be able to help you there. So until next time, that we see you on another Facebook Live, it's goodbye, and Dr. Uthappa, thank you so much. It was definitely a very informative session for me, and I trust each one of you audience out there who've seen this broadcast have felt the same. Thank you, everyone. Thank you, Dr. Uthappa. We'll see you next time. Until then, please stay healthy.